The South African Human Rights Commission is now visiting the Mamelodi Hospital. Follows an incident where a 76-year-old patient was tied to a bench in the hospital's waiting area. Her family wants the Commission to take action against both the hospital and also the Gauteng Health Department. Let's pick that story up with ENCA's Leranzu Temba. Leranzu, good afternoon to you. So what then has emerged this afternoon? What is the Human Rights Commission saying, and what do they want to happen?
I think before we start about what the Commission is saying, Jeremy, it's important to reflect that they did conduct several interviews with the staffers here at the hospital, mainly speaking to doctors as well as nurses. One nurse really did not hold back in terms of the sort of problems that they're experiencing. In fact, going as far as saying that they refuse to be the scapegoat of any sort of incidents that plague this hospital. Let's take a listen.
It's not about the nurses, it's about the system itself.
The entire
system. So I think that's what you guys must actually look into. The system itself. There are a lot of faults in the system.
Just a few examples.
No, like infrastructure.
Yeah.
What can a nurse do about infrastructure? The beds, the stretchers. What can a nurse do about the stretchers? Seclusion rooms for privacy of the patient. What can a nurse do about those ones?
You don't have enough seclusion rooms.
Not even a single seclusion here. And we are getting mental patients who needs to be secluded.
Yeah.
So we can't do it here in casualties. So that's beyond the nurses' capabilities.
Would you say all of this has affected staff morale?
A lot. I cannot even start to think where to start about that one. We are so demoralized.
Lorenzo, I understand what one of the officials is saying, but surely this isn't a debate about equipment capacity and infrastructure. It's about a person who was filmed being abused and tied to a bench. So when the SAHRC officials did the walkabout today, what did they see?
Well, plenty of things. One of them things that they did see was the fact that there is a shortage of ARVs in this hospital. We have time and time again have expressed that there are shortages of beds, shortage of staff. But today we heard from an official in the hospital about the shortage of ARVs, saying that they only have a month's supply. But let's hear it from the South African Human Rights Commission. Thank you so much, Buang, for joining us this afternoon. You were in this hospital speaking to not only the officials, but also just speaking to the nurses as well as the doctors. But what did you find? What was most alarming about your site visit here, Buang?
Well, there are a number of things. I think the first one is that this hospital is too small to service the needs of feeder communities. The Mamelodi area and neighboring areas are growing at an exponential rate, and the kind of service they are receiving here has deteriorated given critical staff shortages. And of course, there are other challenges pertaining to critical and functional equipment that is needed at this hospital. And there are a number of things that contribute to this. And one of the challenges is the instability at the leadership level. They've had an acting CEO for a period of a year now. And the previous CEO also left this hospital under a cloud. And the provincial government has put in a moratorium on the filling of vacancies. They have to motivate in order for positions to be filled. There are also challenges as well regarding the service level agreement between the Department of Health and the Department of Infrastructure Development in Gauteng. And some of the rapid plans to expand the hospital have been delayed as a result of this. So we hope that the Department of Health will present the Commission with a turnaround plan on how they will address human resources shortages, how they will address the shortage of beds, how they will improve the well-being of staff. As we are told that there is low morale, there is high incidence of absenteeism as a result of staff being overburdened and overloaded. This hospital, like many other hospitals that we visited, has a challenge of overcrowding, and it is something that we hope the provincial government will focus on and address in due course.
And Buang, overcrowding as well as shortage of staff could have actually led to how Martha Marais was mistreated. We visited the bench, exact bench, where she was tied for 8 hours. In fact, you even sat on the bench and you were questioning how possible is it that officials here are arguing that she was tied sitting down, but in fact her family found her lying on the cold floor.
Yes, the explanation from the hospital staff, we did not find that explanation plausible. We are still of the view that her rights were infringed, and we will continue with our litigation against the department. We are also amenable to settling this matter out of court should the department wish to offer a settlement of some sort to Mrs. Matamare. But we are also concerned about a number of unreported cases. We were told that there has been a spike in a number of service-related complaints from patients, and we hope that the hospital will monitor trends and develop an action plan on how they are going to remedy the situation and improve the quality of healthcare provision at this hospital.
So you're saying that reason is not plausible, that she was in fact sitting down and not lying down. In fact, one of the doctors was explaining to us that they do have standard operating procedures as to how they detain people who seem to be maybe violent to themselves and violent to others. Then what happened, do you think? And when are we expecting a report back from the commission with regards to the Matamare matter?
Well, the Matamare matter, we want to secure appropriate redress, and we intend taking it to court to obtain appropriate relief for her. And we are also open to a negotiated settlement with the department. But with this visit, we are also looking at other challenges that are plaguing this hospital. And our visit today has uncovered a number of challenges that we hope the new MEC for Health in Gauteng will address, and we will continue to monitor, as the Constitution requires us to monitor the realization and observance of human rights.
Jeremy, there you have it. Thank you so much, Buang. Jeremy, there you have it. It is the Human Rights Commission. But I think it's very important that we do hear from the hospital very quickly. Mr. Dimachaka, we don't have much time, but just take us through your sentiments. There was a visit here, one that you were not aware of, but what are you promising to do going forward?
Thank you. I think we appreciate the visit by the Human Rights Commission, and then from management's the commitments that we are making, we understand that they are here to support us, also to take us through the challenges that we have shared with him. They committed themselves that they are going to write a report which will be provided to management, and we can commit ourselves that we will respond to that challenges that the report that they will be forwarding to us. And hopefully we will forward whatever things that are not within our power to our central office to engage so that we can come up with solutions to the matters.
Thank you so much.
Thank you.
There you have it, Jeremy. The hospital saying that they will fully cooperate with the workings of the Commission. But more than anything, I think it's very important to note that the South African Human Rights Commission is helping the Marais family sue the Department of Health in Gauteng, because they are of the view that her rights were trampled upon and there needs to be some sort of financial compensation for that. Over to you.
You cannot have people seeking help in hospitals being tied to benches. That's the sum total of it. Lorenzo Temba, thank you very much indeed. I want to